Welcome to Health Break by UPMC Health Plan, your quick guide to health, wellness, and how to make the most of your health insurance plan. You can listen during your coffee break, lunch break, or anytime you need a break. I'm your host, Dr. Camille Clark-Smith. I help to oversee the quality of the plans we offer at UPMC Health Plan.
And I'm your co-host, Alex Trainer. I'm a senior health coach who works with our members on healthy lifestyle habits and goals. This is your Health Break. Hey everyone, I'm Alex Trainer. Today we're talking with Susan Clark about the mental health challenges that we may encounter as we get older and how to find and access support at every stage of life. Thanks so much for joining us today, Susan. It's great having you.
Thanks, Alex. Thanks for having me.
Yeah, so to jump right in, we see a lot about mental health in young people, but what about older adults? Are we at a greater risk of depression as we age?
It's actually very common in older adults. Depression is more common in people who have other medical conditions, which often applies to older adults. Approximately 80% of older adults have at least one chronic health condition, and as many as 50% have two or more. Many older adults have experienced losses also that can contribute to feelings of loneliness and depression. These losses are common as we age, but even more so in the past 2 years with COVID-19. They've experienced loss of a partner or friends. Social isolation from COVID resulted in losses of peer activities, senior centers closed, family gatherings changed, there was a loss of religious gatherings, and all of this contributed to feelings of loneliness that can increase the chance of experiencing depression. It's important to know that depression is not a normal part of aging. Depression is a treatable condition that older adults need to be aware of so that they can get immediate help.
Those are some really interesting statistics, and it makes sense that a lot of the situations in our life can impact us differently as we age. What does depression feel like, and can it feel different for everyone?
Absolutely. Depression is more than just feeling sad. It is feeling persistently sad more days than not for at least 2 weeks. Emotions can change and include things such as intense loneliness, loss of interest in things that one used to enjoy, and feelings of guilt. Some people report experiencing irritability, aggression, or bouts of crying. Depression can also be physically painful for some people, who report joint pain, achiness, weakness, and fatigue. Others experience headaches, digestive problems, nausea, and loss of appetite with weight loss. Conversely, others may overeat and gain weight. Many people who are depressed will have problems with sleep, such as difficulty falling asleep, difficulty staying asleep, or early morning awakening. And then there's those that may just want to sleep all day.
There's certainly a variety of symptoms that we need to be watching for. What kind of help is available for older adults with depression?
Well, first, it's most important to recognize the symptoms of depression and to ask for help right away. Because depression can feel like so many other illnesses, it is important to see your primary care physician. Don't dismiss the symptoms you are feeling. And if you or someone you know are experiencing thoughts of self-harm, call 911 immediately or go to the nearest emergency room. Also helpful, there is a National Suicide Prevention Lifeline where you can talk to a trained professional by calling 1-800-273-TALK. TTY users can call 1-800-799-4TTY. Also, UPMC Health Plan offers members a variety of behavioral health resources. Depending on your coverage level, you can access different programs, tools, and services to help you improve and manage your mental health. As a member, you can work with a behavioral health provider or use support such as health coaching. If you're a member of UPMC for Life, you have personal counseling available to you for up to 6 sessions per issue per year with a licensed master's level clinician at no charge to you through Resources for Life. And if your employer offers employee assistance services through Life Solutions, you can schedule counseling at no cost.
Thank you so much for sharing those resources with us. We'll be sure to put those phone numbers in our show notes, too. I'm curious if you can tell us a little bit more about what treatment options are available for depression.
Treatment for depression in older adults is the same as pretty much any adult, and it can include counseling and/or medication. It's really important to be open to these therapies if you do need them. There's zero shame in getting help for depression, as you would for any other medical condition. It's important to view therapy as another form of health care. It's often called talk therapy because you do just that. You talk with a trained professional about what you're feeling to help you make healthy changes to feel better.
Thank you so much, Susan, for taking a health break with us today.
Thank you for having me, Alex.
Visit the show notes to get connected with tools and programs that can support your mental health based on your coverage type. Find show notes and more information at upmchealthplan.com/podcast. Join us as we explore other health and wellness topics in the next episode of Health Break. This podcast is for informational and educational purposes. It is not medical care or advice. Individuals in need of medical care should consult their personal care provider. Views and opinions expressed by the hosts and guests are solely their own and do not necessarily reflect those of UPMC Health Plan and its employees.